Happy Sabbath. Happy Sabbath. Edo Nyankopon ase Ebenezer baby odi abedru na wahwe nyina program yi. Said the edika aba nkae dada no. Health and Temperance Department. A catcher am say abatwe ensafo okunu bi ana abachirechire yen nyema fa dental health education yetumi ho say mpendodo ano so bi te ye ne ya anase ne yafo ye ne ya otumi ko drug store no otedro ano na so ba oral health yes ho ne ma na ye pay attention na so ye ne ye adwo hospital no ye nim say eno so timi do how kase eba ebra yen fa ye nim koso I told a big quite lead to death. So we are doing regional hospital. What do you say? You pay your free dental issues. And until the bus from phone I say, if I say a dental specialist, our head is a regional hospital, dental unit, Koforidiano, or Banoba Church with your BB, and for oral health, health education or dental. Said the bear, so we can sign beer, and I will be a one to us in the room. Another empty, no call dentist. When you are Shama was a baby never, since you baby. With this program, I know what she say, you for not because I did him in Pacific and phone call Betty. Na Yajawomo, because I'm afraid to her, you for her. The beer was him sign be. Now show for not doing muscle. Maybe she said, yes, sir. Because no, you for no more, no more. Oh, almost met Tibi. Not on why you know. My mom pie. Yammy, I don't know whom I brought Dawson. Now, watching in a walk as I train when Pumudin. I said, me a young counting. Yes, she a pea now watching you. I so. I told Safra Okuni wa flan so on the church or Safo. Dental health education. I near my fire oral health. Yes, said there be a bit my boy, man. You're sitting at your time as you be a pain. And to bring me a tone Safra and home come say, rather try and thief in a church train. Nayan or Madia Sadama. That was what amen. Sabre may Dr. Achre. Head of department. It's a regional hospital, head dental unit. Dr. Adelaide Corty. And I'm not and Saffron say, I'm not church there. No man can any man acquire by dog. Community 18 church. As the Masafa Mission, and you meet the church. Akwanya Abase. Church, you are welcome.
Thank you for having me.
Can they see it on the screen? Yes, it's both.
So when they come, they will start. Hello, good afternoon. Pacho, you better try and call our normal bar now you're starting. Or you want me to start?
Okay, in the Yentunum Bakona, and Sunoma or Mafra Tridian, 458. More love today. Yes, sir. You be here. You better say here. 458. More love to thee, O Christ. More love to thee. This is my endless plea. More love, O Christ, to thee. More love to thee. And quite a mama at the side. Quite be inside, I say. And the moha. Esben, Momra. Fegben, Momra. Mr. Omo Pejano so Edo so kakranti. Wow, Babet Matina on our son or Ultima Netra on our son. I have. Aha, what when I'm bet my cost to cry, Montana say Biba. Let sorrows do its way, bring sweet are thy messengers, sweet their refrains, when they come sing with me, more love, O Christ, to thee, more love to thee, more love to thee. When shall my latest breath whisper thy prayer? My heart shall raise, this to its breath shall be more love. More love to thee, more love to thee. Amen.
Okay. So good afternoon once again. My name is Adelaide Quarte and I'm presenting on dental health education. I understand most of you have not really been to a dentist or you don't know much about dental conditions. My tree is not good, so I'll put it in small. So for the outline, we'll give you a small introduction. I'll show you what the tooth looks like. Then we'll also look at what basic oral hygiene is, what you should be doing at home. Apart from that, we'll look at caries, periodontal disease, malocclusions, infections, dental restorations, and we'll look at trauma to the teeth. So when we get there, okay. Then I'll give you my take-home message. So the WHO estimates that a lot of adults have cavities in their teeth. So I'm sure if I were to examine all of you, I'll get a few people with holes in their teeth. And then most of the dental treatment is quite expensive, so it's not covered by the health insurance. So most of the time we advocate that you clean your teeth and then notice when there are small cavities or small problems, then you come in early. Because if you leave it till it's late, it can cause so many problems, and if you are not lucky, you can even die. So when we look at the tooth itself, there are several layers to the tooth. So the very top one is what we call the enamel. Nti anu na ohu wenum no. White surface no. Anu ni na enamel no. So when you slice through the tooth, the second layer is what we call the dentine. And that's where you have some of the nerve passing through. Then the third layer inside no. That's where the blood vessels and the nerves. So that's what keeps the tooth alive, and then you can feel things when you bite. So sometimes when you bite, you feel that, oh, I've bitten on something, it's hard. It's from the nerve tissues, and then and all of it is embedded within the bone. So your tooth is within your bone, and then that's your jaw. So when you look at this picture, you see that I've shown you an X-ray on the left. I think you have to look on the screen, you see better. An X-ray on the left. So, sorry, on back. The X-ray on the left. So this shows you what we call mixed dentition. When you are born, initially you have a first set of teeth. So the children that are below 5 years, 4 years, you see that they have very white teeth, and then there's 5 on each side. Then as you grow, you get to like 5, 6, 7, some of your teeth will start falling out. Then you start getting your adult teeth. Into the baby teeth, no, and no better to 9 penny 4 dear no abba. So when you look on the screen, you see that there are some teeth at the top, then there are some inside the bone. Those are the adult teeth that will come into the mouth later on. And then these are a picture of the adult dentition where you have all your adult teeth. So what are we supposed to do to keep our teeth clean? When you wake up, you are supposed to brush. So there are 3 things we need to do. We need to brush our teeth, we need to floss, then we need to use fluoride, and that will protect your teeth. So brushing your teeth, what are you supposed to do? Regular brushing, we advocate that you brush your teeth anopa and enyumere, morning and evening. Preferably, we prefer that you brush your teeth after you've eaten. So when you've eaten, you brush your teeth, keep the surface clean. And what do you use? You can use toothbrush, toothpaste. If you have trappian, you can use trappian, you can use chewing sponge. Those are also good. So what are you supposed to do? You are supposed to clean all the surfaces of your teeth and then in between your teeth. So I'm going to show you a video on how to clean your teeth. So when you get your toothbrush, you put a little bit of toothpaste on it. Then you hold it at an angle of, say, 45 degrees. Then you clean all the surfaces. Inside, then the top. The top is where you chew. That's when you clean all the sides. And then make sure that you clean all the surfaces of the teeth. Into bed cleaning inside. As you can see here, then the back, the top, the back there too, you have to clean it. Then when you finish, you clean the surface of your tongue. And to clean the surface of your tongue, you can use sometimes, you see the back of your brush, sometimes there are some lines biweche. You can use that to clean the back of the top of your tongue. Or you can use sometimes you can use a spoon to clean it. Then we have flossing. What is flossing? In between your teeth. So then you can use what we call the flossing aid. So we have the thread one. We have one that is like a fork. You use it in between the teeth. Then we even have one that is called the water jet. Then under pressure you use it to flush in between your teeth. So you spray it in and it washes it out. So we'll show you a video on how to floss your teeth. So you use the thread, you pass it between the teeth, in between osino. Now the ahumana ashaho na yi eduane na ewo honum na plaque na ewo honum na. So you do the front and then the back. So you do in between all your teeth, from back to front. So you should always do it in order. We started from left. Now then you do the top. Now I call a train. After that you rinse out and then you go to sleep. So what are the fluorides? The fluorides are chemicals that we have. So they are inside the toothpaste and then inside mouthwash. Then we have special ones when you come to the clinic we can apply to your teeth. So when you brush, you can also use the mouthwash to rinse out. Then you are done. Now we come. When you don't clean your teeth, what happens? You get what we call caries. So how does it affect your tooth? There are 4 things that to take place for you to get the caca in your tooth. You should have bacteria in your mouth. Everybody has bacteria in your mouth. No matter how well you clean your teeth, you still have bacteria in your mouth. Because bacteria, it helps to break down the food that you eat as well. Then you should have eaten something that is either sugary or something that sticks to your teeth. Into didi and inkolan toffee, ice cream, bread, biscuits. All those things that can stick to your teeth, the sugary stuff, it sticks to your teeth, then the bacteria will work on it. As a auto ediane na esi hwa won say ediane to me say. It's the same thing when you leave food in your mouth, essay. And I say release chemicals, I find like acid. Until over time, the acid that is released will eat away the surface of the tooth. Until then you see that you begin to get a hole in your teeth, then it spreads further down into the bone. So what are the signs that you see? If you look in your mouth, sometimes wait to me say white spot be that is the very beginning of the caca. After that, the next thing you see is that you begin to see that as a yikakra, as a portal bow sinum, that's the cavity that you see. You can also see that sometimes it will be black inside the lines in your teeth. You won't say I am dark, and also it's a sign. Then if you are not careful, very soon you feel that menu mensia meya udidi bibia eshe oya. All those are signs. Then later on you start to get pain. The pain that you can't eat, you can't sleep. Then after that, the pain, the infection is spreading, then you begin to get a swelling on your face. And that swelling, if you don't take care of it, then the swelling will start spreading. It will spread into your neck and then can come down into your chest. So these are the stages that I was telling you about. So the beginning, where who say what top and pet, then to go into the second layer, then to go down where I said the blood vessel any pop no one share a new swat, na call down, that's when the infection starts to spread. So then we'll show you another video, make it more interactive. So this is the top layer and then the second layer and then the pulp. So over time, when you eat and then the food is on the tooth surface, you get the acid eaten away, then you get your white spot. So you see the bacteria and the acid is acting on the tooth surface. Then it is dissolving it. So as it dissolves it, no, every layer, no, portal bi wo esinum, then it moves down all the way into the dentine, the second layer. So you can start at any part, either the top or in between your teeth. Then as it moves, then it goes further down, then you get to where the blood vessel and then the nerve is. Another way as I said, can also start from in between your teeth. So sometimes you have a hole in your tooth, they wouldn't know where it is. You feel that there's pain, but you don't see it. It's because it's in between the two teeth that you are not seeing, unless maybe you floss. When you floss, then the thread will catch. Then you know that there's something going on there. If it spreads further, it will go all the way down into the root and then the apex. Then it spreads. Then that's when you start seeing the abscess. You see that, oh, menimna hunu kakra ahwa peja. So then there's another thing that I want the mothers to take note of. This is what we call bottle caries. So sometimes the babies, as you are feeding them, some of them are fed during the night. So as they feed, you get some of the breast milk on their teeth, or if you are feeding them with the bottle milk, they get it on their teeth. As over time, it's all over their teeth. So it begins to work on the tooth surface. The bacteria, as I said, produces the acid. Then you start to say black. So as I said, is it moving? I'm moving. So you see how the milk goes all over the teeth, then Then the third thing that affects most people, but this one mostly is adults, teenagers, adults. So if you don't clean your teeth, you notice that when you look inside your mouth, you see that there's either a white film, baby white was in one cleaning a year, saliva never will no. Our calcium and minerals, then it me yet sad dear white no. Now yet din na yellow. Next, a tartar was in. If you are not careful, sometimes you see that it looks like black or even green. So you either see it like the one there, we have the plaque, then the calculus. Calculus na yellow, no, na tartar, no. If you these ones, when you brush, it won't go. Unless you go to a dental clinic, then they remove it with the machine. We have a special machine for that. Then you see that it begins to look a bit nice. But if you don't clean, you notice initially it starts as the friend gingivitis. When say gum no na peja na hono into brush kakra pe na moja ba. But when it's like that, o brush na moja ne ba, e say o continue say o brush e be jai, because niema na taro sin na ma na yesa no. Into one brush na koso, then you get the second one, the calculus, and then the discoloration. And as it is there, Who say o se first na gum no level near nice. Who na sa dear way calculus no na push gum no back from. Who sin I say I tintin wo we no. And no na ye friend periodontitis. So on the first one, who say first na fine. Odi your idea be a friend probe. Ye they call round who sin say enkomu bebre. But as calculus no ba na tari sin na wo ho no who say probe na be call down. As a call down and no so che say o don't pay no and no so we na call form and I was sin e be tin. So what are the risk factors if you don't clean well? Poor oral hygiene or diabetes is a problem. If you have hypertension and you are taking antihypertensives, that too can give you gum disease. And hypertension, high blood pressure. No, u smoking, unum jota, a foul sin. Then those who drink a lot of alcohol too, that one too affects it. And then the mothers, when you are pregnant, because there's a change in the hormones, no. Sometimes when we say now gums, no, I thick, swollen, and then sometimes it can be painful. Then if you are not eating well, malnutrition, if you are not taking fruits, vitamin C, you see that your gums too become swollen, then they start bleeding. Then the last one, if you are immunocompromised. So as I said earlier, the main things to do is to brush your teeth. If you are not brushing well, and when you have calculus, and you get so banana, you treating and amount. And also, the osin started say a tintin, you bet me a surgery. Na don't pay asha ho na the gum na ataris na a level. And Anko yena said don't pay na conforma, then your osinu na edge na ona hoso and no dear uba ye be too sino. So this one will show you how the calculus forms and then how we clean it for you in the clinic. Into be who say udidi then later on o chuchu simba o chuchu ni year. Ube who said sa nema yellow no. E tari o sinu. Until sometimes yes say tari o sinu pe. But I call between the tooth and then the gum it me call down. Into I know the brush ni ya enko. Tisa oba clinic no na ye the machine no. Achuchu ni na amao. Into ba your instruments I yedi it I say sekan ketin bi na yedi stone na etari osinu intenu ne calculus no. Then we remove it nicely for you. So this is the one that we use the machine. So as we are cleaning it, it has water. Then to be washing off all the calculus and the fine water. Then there's another thing we call malocclusion. Ubetumu who say ebimu omusin aisaye ebi weni maybe wechi crowding. Ebi so be who say omusin e kwan didemu. And na your friend in malocclusion. Until no dear over who say someone will come, their teeth and him no and sisuye a kwan didemu. Ana ne jaw no baku ketwa baku so. Ana baku wo echi. I say we nim but we echi. Ana baku so my friend esibo glass no. Your teeth are outside. And then for the children, those who suck their thumb, more monument monsano. Monument sa na mo pushy esino. Ube se na wenya ekwan wo ha na osini eko abonting. So these are some of the treatments we can do. If any orthodontic treatment here, the braces shena ya shisheni ye. Nti we buy a first one na enim no ensi so ye. Nti ye treatment won say afa de fine. The bottom one say crowding. Nti we've unraveled it after the air straight. This one too the same. And this is what it can look at the beginning, then the end when we straighten it nicely for you. The same thing, beginning and then the end. So, one teacher will say, Onya cavities, problems, no, what can we do for you? For the children, oh, back. When you come and then we notice that as a portal was in a muwa, we can cover it for you so that you don't get a hole going through. So we put what we call a sealant as a raincoat. So most of the time we do it for the children. If you come and you have a hole in your tooth where you will see it, so we protect the other ones so you don't get a cavity. So that is the sealant. But if you have a hole and it hasn't gone deep, so we say firstly I know enamel, second no dentin. Unya cavity, we can do fillings for you. So we have the silver one and an amalgam filling, and the other say cynical and a composite. And then the CSC no out where to make you see no. Another one so your friend inlay or onlay, and no the try cavity na ya CSC na taking measurement na the call lab na ya osinu shape na the asisu ama nicely. Oh. It's okay there, but it's okay. So, as I said, if it goes deep inside into the roots, and normally we'll tell you that if your tooth is strong enough, we won't take it out. What we'll do is we'll do what you call root canal treatment. The inside the root, the baby like pins, files be. Inside infection inside the canal. Clean. Then we wash it nicely. Then we put an artificial rubber material inside. Then we reduce it. Then we put some pins to hold it and make the tooth a bit stronger. The filling material. So this is the root canal, then the pins, then the restoration. After because it's gone down, you've taken out the blood vessel and the nerve, then the tooth becomes weak. So for you to be able to use it, what we do is we cap it. I don't know if in a crown. Until you you're taking measurements, now they call lab. Now then now your tooth is all nice and fine. Then you don't have a gap between your teeth. But if you go ahead, the tooth is so bad that it has to be taken out. It has to be taken out. Then you would have some problems related to it. Oh. So when the tooth is taking out, you see that there's a gap. After that, because a sinly bini a form, a strong beba form, trying to keep in between the space. And as there's over eruption, the tooth is coming down. Because there's space in front, the other ones too will drift into the space. Into when you calculus all over the place, then your gums become sore. So what are the things? So what to see now? What can we do for you? You wait to me artificial essence be ashe wenum. Into benya yet their friend no dentures no. Into na udi ashe wenum. If you've lost all your teeth, waba ya tutu sini na enya ubenya full your friend full. Into nama uwasi nice utumi smiley but ni na ya artificial. And then with the dentures, if you come and we give you the dentures artificial, no, when you are going to sleep, you have to take it out, clean your teeth, and you put it in a cup of water. But what we realized that most people, because they don't want people to know that their teeth are not their real teeth, they keep it in. And when you keep it in, as I said before, when you eat, there's food in your mouth, there's bacteria. And as the bacteria is acting on the gums and your teeth, your gums too become very red and then painful. So if you have dentures, artificial teeth, the one that is not cemented onto the iron glue dentures, you still brush, you clean your teeth, you clean the gums nicely, then you sleep. In the morning, you wake up, you brush your denture, clean it nicely, then you put it inside. Then you go to work. So these are some of the artificial teeth. The one on the left, who said, the very left one, where artificial tooth, yes, Then another thing, if you take out the tooth, they are way to sinner. You wait to me reduce way na artificial shower so that there was shown emba and share from the. Then the other one too is we can do what we call implants and where screw you screw share space na artificial assist. So that one no one will know that you don't have an artificial tooth in your mouth. This one, when you are going to sleep, you don't take it out. Then we also have, most of the times, trauma to the accidents. Accidents from falls, from road traffic accidents. Then so we have two types. Because initially, Mokai said, me can't say, in Kolanum, Omunian, they have their own set of teeth before the adult ones will come in. So with their children, the baby teeth, when they have trauma to their teeth, there's a problem with that because you have the adult one inside the bone. So when you have a problem with the baby teeth, it can affect the adult teeth. So you see here that there are various types of trauma. You can have some small concussion, I say, obo form kakra, but nisina say. Then you can also have the one that's obo form nisina say start to say shaky. Then the other one is when obo form and I say esina pie, but nina in pie. Then you can also have the one that's when you fall, then it comes out. It breaks through the bone and it's sticking out. If you are not careful, this one is when it's this one we push it back, but when it goes inside, inside a pin permanent one. Sometimes a pin permanent one. A bit to me, ama esino achia or roots. It depends on the development of the tooth. But when it falls out completely, and that is it, it's gone. We don't put it back in because if you put it back in, it will infect the adult one that is coming. Then you can also have the crown, the white part of your teeth, just breaking. That one, if it breaks and you have the small piece, you can bring it to the clinic. We can stick it there for you. But if it goes deep inside, baby, I call the pulp and the roots, and the too amount. And then when it breaks through the bone, that one too will take it out, because the adult ones will come in. But when it's a permanent tooth that has an accident, or either it falls out completely or a chiakakra, that one, there are different things that we can do for you. So if it's your adult tooth, small concussion, that one, we just give you medication and watch it. But as it begins to move inside or outside the bone, then that one, we have to fix it back and then splint it. The wire, wire no. This is the most important one I want you to know. The one that if it's an adult tooth that comes out, immediately it falls out of the mouth. But that one, you would have to bring the tooth to the clinic and see. You take it and then you don't hold it by the roots. Baby, I shall we know the white part. You hold it by that one. If you can get water, you rinse it off and then you put it in a cup. In the cup, you don't want the tooth to become dry. If it becomes dry, it will die off. So what we do, we tell you to do is that either you spit into the cup. So if the child, let the child spit into the cup to lubricate the tooth. You cover it and you bring it to the hospital. You have to do it within 12 to 24 hours. If it's more than that, we can't solve it. But then if it's just the top part, white part, and you can see the piece, you come with the piece, we can stick it onto it again. But then if it goes deep into the roots, maybe I'm a kind, say root canal, first one. This one too, we'll do the root canal, then we'll put an artificial tooth on it. But because if it's a child and it's growing, you are still growing. So that one, it'll be like a temporary cap on it, not a permanent one. Then if it breaks completely out of the bone, movie, and also then we wire it and then stick it in. Now you're strong. Then the last one is RTA, fracture. So this one, the tooth has moved completely inside and then some of it fell out. And then motorbike, helmet now. When you have accidents, not only are you going to get cut off your face, but your teeth will become broken. Then the last one, I told you that initially, if all this continues and you don't come to the clinic, it can spread into your bone. So this one is the scary part. The infection will spread, and when it spreads to the gum. Inside, now if from here you don't come for us to give you medications and drain the infection, then it becomes what we call Ludwig's angina. And that one is spreading infection inside the soft tissue, as I said, down into your neck. So when it comes down into your neck, below here, that's where you have the muscles that support your tongue. So if you have the infection filling up here, what it does is, and when a peja otekremano, it will block your airway. So this is what we are seeing. So it blocks the airway. Then you are breathless. If you are lucky and it doesn't block your airway, then it will start trying to find a space to come out. That's when it's going to try to come out of your neck. Now say pomponcio, but it's very thick and very foul smelling, very, very bad smell. Now, but into this one is the scary part. You get the pain, the swelling, you can't eat. When we say intensio, but now the saliva will just be coming out. Bad odor, you can't open your mouth, then your tongue is raised, then it becomes like this. This is the one that we want you not to come to the hospital with. Asperdia, then it eats away your skin. If you are not careful, for this one, you can't breathe. Then we have to put a tube there for you to be able to breathe. So this is very, very serious. So what is the message that I want you to take home? I want you to know that toothache and dental infections can be very, very serious. So you should brush twice a day. You should floss. You should use the fluoride mouthwash. Then you should have healthy habits and then regular dental visits. If you have problems twice a year, fine. If you don't have much, then you come and see us once a year. So this is my take-home message. Thank you. Do you have any questions?
Yo, Abusiafo.
Do they have questions?
Ebrason, say bisa questions. Wa o asemise bia no. Obetimi ama so na ye bisa na me medical. Doc ye da se bebre se ma de abre. Didi kan pese me bisa se em se do usika ne mu bi won ma ye visit dental hospitals ni ade. Na etoda ana adwene bi ni se afi na woko bie wonum pa de akire wo yonko ahwa na nipa kora bemabu enti eno no afutuo be na adoma ye ho say we feel say maybe it has gone so bad say afi nya afi na woko bie we so akire ododom ho no de akire wo bi ahwa de obohunu na wan hu yi enti afutuo be na ho so ena mpacho me fam second one nkan opreko mate say toothpaste bi wo no ma fluoride nim na no so no I drink be na techiri and I say omu nimse bi e be kwakoto mouthwash bi intina eno de bi ni mu ana.
Okay, so for the toothpaste there are different toothpaste. There are some that don't have the fluoride. Then there are those that have the fluoride. So to obehwe package no mba say ya cho fluoride no wo ho. It's in numbers in parts per million. So for now on the market there's a 0 to 5 year one for the little ones. Under 2 they have their own special toothpaste because the fluoride that the adult needs is not the same quantity that the child needs. So there are special toothpaste for young children and then the adults. So the adults we are talking about over 6 or 12 years. So that one. So the ones on the market that have the fluoride, Pepsodent will be Colgate, Aquafresh. All those toothpastes are more fluoride. So when you are buying the toothpaste, make sure that it has the fluoride in it. Then the fact that you have a cavity, Osena say, and you are feeling embarrassed to come, that is our job. That is why we are there, to look into your mouth and then solve your problems for you. So it's not something you should be shy or afraid of. Right now, there are a lot of people who have bad teeth, but see your face mask na boa. Almost so they hide behind that one, but you should come. Because there are so many things you can do to prevent infection and to prevent it from getting worse, like untumindidi.
Oh, me that's it. My name is Obi. Are you ready? Person, we say no question. I be the microphone. So see ya. Okay.
Doc, Nyaminshaw. But they didn't kind. There are a lot of myths about mouthwash.
Yes.
I can't say be found because so we treat. And when he say we use toothpaste with fluoride now, say at all mouthwash.
Okay.
Yeah, number one. Number two. Back those days in the village, now you use brodier now. Now the
I don't know.
And then maybe some typical villages and those things are still there. Fluoride ewo enuma na say and the champion so ebiano. And also fluoride no ombenya wine na omo tumi akipu omusically. And the last one. And my friend so munya sometimes bu ha won kusa nkora ni bu ha mo se no arrangement na say the tie no anya papa. Age be na omudu a ohun se we dey one farm hospital I be a problem beba. Because we now was 6-7 years now was an arrangement and then said that thank you.
Okay, so for those who use the trapia and the ash, those ones they only say a bit cleaning, but there's no fluoride to protect the teeth. So you can still use your trapia and whatever, but at the end of the day, then you brush with the toothpaste, then you protect the tooth surface. But the other thing too is that the trapia and then the chewing sponge, I know they end to make cleaning in between your teeth. And some people, what they do is that the chewing sponge, they just chew, then they spit, but they don't actually clean the teeth after they chew. So if you use those ones, after you should actually clean and brush the surface with the toothpaste. And the mouthwash, if you are regular and you are using a fluoride toothpaste, you might not need a mouthwash. Then the children, what we say is that the children, as soon as a tooth comes into their mouth, it has to be cleaned. Into 6 months, 5 months, 4 months, who say a sinner by yourself start so treating. Now who say a sinner, you treat a sin. Then when they start getting the mixed dentition, you can see some adult teeth, the baby teeth are there. By 6 years, 7 years, you bring them in, then we do the assessment for the arrangement. Then we start monitoring them as they go. Okay.
Yo, Mr. Fosu Champo.
The patron was in Buzakakra. Ubuwa ne CF pa, so ne number, and I'm quite better than the Timbansa.
Okay. So you are seeing that nenum yefe. But our back clinic now we say and you say nenum ne yefe. That calculus ni manima mature yellow na tires no. Ube say tire inside ni na a pushy gum na ako down. Sometimes you even have food inside, air pro, and also bad breath. Then sometimes bad breath is not just from the teeth, the calculus, but it could be coming from an infection within your throat or your lungs. And also to me, basa. And then sometimes some of the children too, you see that sometimes they might have bad breath. Some of them, they play with small coins, push them inside their nose and things, and then they start getting infection. And to my bad odor number. Sinusitis and pneumonia. And no dear, ubot me call ENT specialist so no more inside your throat and inside your nose, whether there's infection there. So the bad odor is not just from your mouth; it can come from inside your nose. We have some spaces within our head to make your head lighter. That's called the sinuses. Unya infection or you can also get bad breath.
Yo, Doc, Pacho Obi Bisa online. Say, is it advisable to whiten your teeth? Me go one chair at the cry of whitening there, but was it Obisa say, is it advisable say over whitening with teeth?
Okay, so what whitening your teeth means is you're actually bleaching the teeth. So you bleach it to make it look whiter. So maybe your teeth, you have stains on it. I had dark akra. I know the other clinic na ya amau. But the other thing about bleaching your teeth is that if you are not careful, about me amau sina is sensitive. Into be from a fawana as a kick you eat ice cream as a kick you. So normally when you do the bleaching, they are supposed to treat it with the fluoride. That one is a thicker paste. Then they put it on it to prevent the sensitivity from happening.
Pacho, maybe say a crowd of 5.5 years, but a complacent is shaky. Pacho normal na say and it to me cause a problem.
Okay. Inti akola oye 5 years and the same shake no. That means the new adult one, mpanyifo de no eba. Inti no de in class no ebe shaky answer. But sometimes no shaky. Eba wo echi. Baby teeth no ho, but then the adult teeth are coming, but they're coming behind. And you have to bring them in so that we take out the baby teeth so that the adult one can move into the space.
Pacho, my question no, sometimes me will fear no pa. I am intending to chi missing. Me chichi so I say me did area and sana me chichi because an agent me koda.
Why chichi see that?
Because it sustain me to the next morning. See, and also.
So that one is actually the best thing to do. After eating, then you brush. If you eat in the morning and you don't brush after that, you still have food particles within your mouth, in between your teeth. And as I said, no, the kakano, it takes time. So you need the bacteria there, you need the food there. Then over a period of time, then you get the holes coming between your teeth. So it's advisable that even if you can't brush after eating, you rinse out your mouth with water. So you swish the water around, remove all the food particles, then you swallow. Then when you get home, then you can brush. But the most important thing is to brush before you sleep. Because when you go to sleep, the saliva in your mouth, it reduces. And the saliva is what washes the tooth surface and removes all the debris on your teeth. So brush, floss, then you sleep. And after brushing, you don't eat. You can only drink water.
Mommy, maybe sir, say kakano. At times me huni pabe bra, almost sitting me home. No the Aba hospital. Ombo si yetu. Eni bosome na asa baby no de ko wasi yetu. Timi na tuya nlesi mutuko timi bisa se so ne ede sa de ne ba no eti aduro bi enu betimi ayi asabo na firi ho ede sa aye etutu ne ba na.
Okay, so they are all canon. There are some people, they come to the clinic, they have, it's not one cavity that they have. A kaka na nye ba no wo or kaka bebre. Sometimes a nye kaka pe no wo. Say sometimes you can have the gum coming down. As a ayetintin we num keka. I know the keka na say root na. That one there's nothing you can do. Once you can see the top of the tooth and the root, I can't ne shoe in pen out and they are into a new there. You see that they come, they'll be removing. Then we give them the what? The fufu denture. No much artificial no. So if you come early, where you have the calculus and you have the periodontal disease, and then they clean it for you, then you can stop the destruction of the bone where the tooth will be standing. As a senior age now, but it's dancing as well, rotating now. Yes.
Question, Kakra. Question in there. At times, I call hospital in anyone. What's the easy carrot and baby? But can this swabia as you get that over to one my gum and wire strong and teeth nice strong.
Okay. So it's all fruits with vitamin C are good for your gums. Then anything that has calcium in it, into milk, meat, then some of the green vegetables, they keep your oral health healthy.
Okay, me so me question is too. Bako, me find say o be 12 years now say but when who part no, you know dey any like mine. Okay. You see, I me go hospital. I think say umbetime asili ama me. And at two, unse nkola Muslim almost any bar. I almost use tomatoes. No we almost do wash it. And no thing I almost use sa ade no. And what is the secret behind it? Almost use tomatoes. Normally be a pepper or menum no must say ade no.
Okay. I want to ask a question. Okay. So I think the reason behind the tomatoes that they are using is that tomatoes, you have vitamin C in it. That's the only reason. But ideally, you should use toothpaste and a cleaning agent, either a soft toothbrush, medium toothbrush. Now they are cleaning. Oseno, remember I showed you different types of fractures. So Oseno, if it's broken, it depends on where it breaks. If it's broken, just some small crack, that one we do nothing. But if it's broken and like just the tip, and something small, oba a tooth color material, now you're building up, now you're fine amount. But if it's gone inside, say inside, that's when you need the root canal. Then you need a crown to cover it. So it depends on what level of the fracture and how it's fractured.
Pacho mi same bisa say aduane a yedi no enye nsunsuanso awo yense kala no so ana.
Does the food affect the color of your teeth?
Yeah.
Yes. So if like the person asked earlier on about the bleaching, if you go and bleach your teeth, what they'll tell you is that you shouldn't take anything that is colored. So what is colored? Tea, coffee, wine, red wine, palm oil. They all can stain your teeth. So if you go and you bleach, they'll tell you don't use these things, otherwise it will change the color again.
My question is Sabio in row iron no to me as a send color permanent and I say Savia Jaredon Noma. It's no.
Yes. Drugs that discolor the teeth permanently, where you get teeth discoloration, is when the mother was pregnant and she took a medication that can bind to the bone, any hard tissue. So things like tetracycline. If you are pregnant, they'll tell you don't take tetracycline because it binds to the calcium within the bone, and because the tooth too has calcium in it, it can bind to that, and then you get discoloration. So you see some people, their teeth are like gray, light brown. That one, whatever you do to it, it won't change because the color is within the substance itself. It's not just on the surface. The one he asked, the ones on the surface, the tea, the coffee, the wine stains, that one you come to the clinic, we can clean it off. You understand? But the one that is within the tooth itself, that was a chemical reaction. That one, you can't take it off. So you end up needing crowns and your friend veneers to cover the tooth.
But near the hall. Brush bena Oshanka Yamaye, the way I been near hard, if near soft. It's a binum to me chikra maybe an amoja. If it's because it's soft and I know yet the mom. It's not near Yamaye.
Okay, so the hard brush is for smokers. When you smoke, get the tar stains on your teeth. So you see that the smokers, they have very dark teeth. So that's why they need the hard brush. For children, soft toothbrush. The rest of us is medium. Into uko shop, uko toothbrush. We say I chop medium, soft and not hard. Into uto medium and not soft. Because you see hard one now. They don't do it at the 45-degree angle. When it's straight, say, as a scrub floor, no, as a scrubbing brush, we treat from. And no, dear, scrubbing it say, I won't say, a bit cut it as sin on the side of your teeth, as I yet like a ledge, as a window sill, no, won't say, na window, no, it's not straight. There's a portion inside, then all the tooth tissue is gone. So if you use the hard brush, you cause more damage to your teeth and then to your gum. So use the soft brush, and then you brush at an angle or in circles around your teeth.
Mpacho, me pesa no say ablewa kra na num etutu kra esi ni na num no. Mo petimi aye artificial na man na didi awidom pe ma ne ho atona na. Ena me pacho ba ko no so ne wo si wo wanum a enye hwe wo be hu na esi ni so ebubu eno so me pesa me hu ne de eno ba.
So the abrewano, they are only synchra way fufu. If it's either this one or this one. If it's a synchra beer, you can do the implants. What they do is that omo the school in kakraba share aha and aha na ye crown way. The bridge, no, they are siso. I know it's very expensive. But then there are the denture, no, they share now. Then you can eat, you can talk, you can smile.
Pacho me say e sini bi wo ho a un se enye hwe enye ne ya betu be hu se na esu ebubu.
So that is part of the one I was telling him about the stains. That one is from development of the tooth itself. Into the outer surface na strong. Unto be who says sometimes it looks like I don't know how to, I say it's just chipping off. Well, ebubu. Over one na yet say brown. That means the top surface na FN enamel no, they are white and strong. Into na ebubu sa no.
Okay. Mpacho mo fra no mo hwa de mo fra Kofi mo nyina bia hwe mo hwe ayi so mpacho se ayi na edition vivi na yedade yedade se mo hu ene me de make an say prevention is better than cure. So we be gina pa ko do stage ye do we be show simu a ne
We are done now.
Mese na ebi bisa cost of nima bi, but I know the ebia enye ha na ebeka no ebia e betuma nya overview bi dia, but the ntimi nya specific se bia me kotwitwi mesi a say.
Okay, so in general the general clinic, the obana yi calculus no out of your mouth, it ranges from between like 100 to 300, 400 cedis. It depends on where you go. So if it's a private clinic, it's likely to be higher. But overall government facility, it will be a lot more affordable.
Yo, doc, but your baby says, and can the papa more as I say, CBI white, and I say a be white, said the TBI and here say a white sana design.
The only people that have very white teeth are the children, the baby teeth. That is very white. As the adult teeth comes in, you see that it's darker. Why is that so? Because the second layer under the tooth, no, and now you're a little yellow. So as you are, for them, they have little of that layer. And that's why it's white. But the adult one, you have more of that layer, so it's a bit darker. And as you age, your teeth too get darker. But you can always bleach if you want to change the color.
Madam, yedase. Pacho me bisa se e ba ne sen na akwala ewia ne senior nketenkete fine. Estasi tutua.
Na kese.
Aya kese mpanyfo bu sa ne bia ya tentenya de den e koso sade no. Me ni sama yam dada.
So that one, for a child, you have a mother and a father. Sometimes the father has big teeth or small teeth. The mother has small jaw or big jaw. So it depends on what you get. You can have a child that has the father's jaw, which is big, the mother's teeth, which are small, so they'll have like spaces in between. If they have a small jaw and big teeth, then they'll get a lot of crowding. When say a quine near walk on and so Emma is snare, so one will go in front, one will go behind. Then you come and then we can rearrange it nicely for you.
Yo, that's it. So I simply say be an audience.
For a day.
Twice. Morning and evening. Evening before you go to sleep.
And then say, who did you be as well? Why you from?
Okay, thank you very much.
Thank you.
But I'm from the 3, 2, 1.
Sorry. My Jesus, I love thee. I know thou art mine. For thee all the follies of sin I resign. My precious Redeemer, my Savior. Better last stanza. In mansions of glory and endless delight, in mansions of glory and endless delight, I'll ever in heaven so bright, I'll say with the glittering crown on my brow, if ever I love thee, my Jesus, 'tis now.
Dr. Adelaide, and you are Sadaka on behalf of the church and man. So, my church again. A better tree and Safro Bill. It's a screaming crime about the Yamay. Edamas. Bompire, my nephew and fashion name.
Mama, Bompire. She jumped on every man that was sick. And I die, ye. Now, Oma can say, and so in shame near Sumo. No mkono wa soso akasa ya chere ifri anopa omo yakonya menu odi nkomo nyumtuo ene mpabo ahuduo mu de twa to kra wakasa kyerɛ ɛfa yɛnum apɔmuden ho yɛda wase nsɛm a ɔde abrɛ deɛ ɛsɛ ɔne sɛ ma yɛn ho ahoɔden yɛntumi nto anamɔ a ɛde bɛsie oduafo a ɔde no firi kɔfɔdua ɛbɛkyerɛkyerɛ no yɛde ne hyɛ wo nsa ɛberɛ a ɔfiri hyia bi ha kɔ yɛsɛ ɔsɛ ma no kwan wo sɛ nkɔdu ne fie ɔne n'abusua ɛsɛ ɔsɛ hyerɛ wo bebree na bɔ no ho ban ɛwɔ n'adwuma mu ma adwuma a ɔde ne nsa asɔmi no ɔntumi nyɛ na ɛmmoa adasamma na ɛhyɛ Onyankopɔn din animuonyam wɔ Yesu Kristo din mu nti amen.